Today we're going to look at the functional squat and how to use its analysis to help your patients get better. So the functional squat can be used for a variety of conditions. It's most commonly used for lower extremity issues, low back issues, but can be used for shoulder and upper back issues as well. So what you're going to have to do is have your patient stand with feet at shoulders width distance and then arms in the air, and you instruct them to sit down as if they were sitting into a chair and have them continue to do so slowly about 5 times. Good. So the first thing you're going to do is take a look from the front. So when you're looking anteriorly on your patient, you're checking the knees over the ankles and you're checking their hips to make sure they're not swaying back and forth. And when you're assessing your patient from the lateral side as they're doing the squat, you want to make sure that you have the same angle with their back and as their shins as they're going down. And then you're also taking a look at the low back to see if it is having the hyperlordosis or hypolordosis during movement. Alright, and then as you're watching your patient go into their squat, and if you see them do a shift of weight to one side or the other, or if you see one of their knees come in, you need to assess the hip rotators, especially glute med, and then also assess adductors to see if a tight or overactive one could be causing a shift in weight. Alright, and as you're watching your patient from the lateral side, and you see that their heels come off of the floor, it could be a sign of weak dorsiflexion. You want to address that. Or if you have the patient do excessive forward bending so that the line for their shins and back are not aligned, it could be a tight psoas muscle. And then also if they can't bring their arms up any further, it could be due to a decreased extension in the thoracic spine.